Gentleman is recognized.
Thank you, Mr. Speaker. Ranking Member Mr. Scott for Yearly. I rise today in opposition to H.R. 1101, the Small Business Fairness Act. Mr. Chairman, the concept of association health plans, AHPS, is nothing new. Versions of this bill have been around for many years. They don't work. Currently, HPS are regulated by the states, ensuring the ability to protect consumers. H.R. 1101, however, will yank association health plans from the realm of the state oversight by federally certifying them and holding them to few, if any, regulatory requirements. This would strip the states of the ability and fidelity to regulate beneficiary protections that exist to protect their citizens. Federally certifying AHPS will allow selective choice of which benefits are provided and which persons can enroll. This is a complete and total disservice to all individuals and citizens in a state's health insurance market. Association health plans currently exist and operate in New York State, serving many thousands of beneficiaries and avail New Yorkers protections, benefits guarantees, and avenues for appeal through the Department of Financial Services. This bill does nothing to offer guarantee affirmative coverage. It will permit pre-existing conditions as a legitimate reason to exclude individuals. It has no minimum threshold for anything resembling essential health benefits, and it fails to offer a requirement for the actuarial value of insurance products to cover total health costs. What then remains is not a health plan. In fact, what remains is strikingly similar to what the American Health Care Act purports to offer millions of Americans: less coverage for those enrolled and more expense for those who are too sick, too old, and too poor to be approached by an AHP. AHPs will lead to higher costs for seniors and individuals who are sicker and will dilute the risk pool of entire states, leading to higher premiums and out-of-pocket expenses. Where the American Health Care Act will be unilaterally hurt all Americans, H.R. 1101 will accomplish the same harm directed at the sickest and most underserved in a more prejudicial manner. Mr. Chairman, I offer an amendment to this bill which was germane, yet not made in order. My amendment will have protected the rights of the states to regulate association health plans, to include regulation of benefits, consumer protections, and rating restrictions. The goal of my amendment was to ensure that all states and their constituents have the same security and protections that my constituents have benefited from over the past 7 years. Consumer protections against surprise billing and adverse selection. Provider protection for prompt claim payment and pre-authorization. Protection for local and regional insurers so that large national insurance companies cannot cherry-pick the good risk. I certainly believe and I hope that my colleagues on the other side of the aisle support a program integrity and protecting our constituents, which is why and what my amendment would have made clear. Lastly, I would like to be clear that I am supportive of increasing access to health care that is comprehensive and affordable for all Americans. The bill before us does not do that. The American Health Care Act certainly does not do that. I urge my colleagues to strongly oppose this bill back of health care. Thank you, and I yield back the remaining part of my time.